In this short tutorial, I am going to discuss about the clinical anatomy of synovial joint in a nutshell. So, to learn the clinical anatomy of synovial joint, you must remember 5 points about the joint in a nutshell that I am going to discuss along with drawing the diagram of the synovial joint. So, synovial joint comprises of two bony endings like this, covered by articular cartilage at both ends to prevent the rubbing friction against the bony elements. This is the articular cartilage covering the bony ends. And overall joint is enclosed by a capsule known as a joint capsule. And internally, this joint is lined by a membrane that is known as synovial membrane or synovium. So in red, I am drawing the synovium. This is the synovial membrane or synovium. Inside this synovium, there is a fluid that is known as the synovial fluid. This is synovial fluid inside the synovium. This fluid mainly comprises of hyaluronic acid. Now I am going to tag these points here. So this is the bony end. So there are two bony ends. This bony end is covered by articular cartilage, and outside the joint, I mean to say, joint is overall enclosed by a joint capsule, and internally, joint cavity is lined by a membrane known as synovium, which is responsible to produce synovial fluid. So inside the synovium, there is synovial fluid. So these are the 6 points that you have to remember in the clinical anatomy of